Pour poursuivre l'entrevue avec Daina Crafa, Madame Daina Crafa répondra aux questions en anglais. Elle s'intéresse donc à la psychiatrie transculturelle et aux neurosciences culturelles. Madame Daina Crafa, pourriez-vous nous expliquer votre recherche qui allie ces deux disciplines?
So, cultural neuroscience is basically an area of research that mostly studies, healthy participants, so non-patients, and they look at differences in brain processes and also in some genetics across different cultural groups in order to understand if culture actually shapes the, the processes that go on in the brain and the person's genetics. And transcultural psychiatry is an area of research, but also of clinical practice, and it's more oriented towards working with patients from diverse cultural backgrounds in the clinic, and also studying what is different about disorders across cultures and within different cultural groups. But this is a much more behavioral and symptom-based field, and it doesn't do as much neuroscience measures. And so my research is actually at the intersection of these two areas. So the difference between ethnopsychiatry and transcultural psychiatry is really that transcultural psychiatry is a lot more oriented towards clinical practice of actually working with patients with diverse cultural backgrounds, whereas ethnopsychiatry is a field that tends to study how people within a culture understand medicine and mental health. And so this is really about the perspective of the people on the medical system versus a medical system that can help people.
Madame Crafa, vous avez étudié en anthropologie et la culture est un élément très important au niveau de votre réflexion en recherche. Mais qu'est-ce que la culture?
Yes, so culture is a really broad term. It's probably best defined as an ongoing process of converging social and contextual elements. So it's not stagnant. Culture is constantly changing, and people within a certain region or social group can choose whether they subscribe to certain aspects of their culture or not. So this choice is something that can be made unconsciously, but it's also something that each person has control over and can change to some degree. And in the sciences, culture is a very tricky concept because it's hard to quantify. So I've proposed that culture can be thought of as a set of statistically common beliefs and behaviors that are common to a certain demographic of people and region. Yes, so this definition provides kind of more options for measuring culture because it can really be measured now by certain traits on questionnaires or through structured interviews. And it can also be extended to include patient populations. So, for example, each patient group in a different culture has a different set of statistically common behaviors. And so some of these might also be different from the culture's, kind of general social norms. So behaviors that reflect the different perceptions going along with different disorders, for example. And so we already know that there are many differences across cultures in the appearance and some of the symptoms of psychiatric disorders. And in theory, these differences should also be reflected in brain processes and possibly also in epigenetic traits. But this possibility hasn't been widely studied. So this is kind of the guiding research question that my work generally tries to answer. By investigating culture and disorder from different angles using different neuroscience techniques. My research aims to combine actually principles from both the fields of cultural neuroscience and transcultural psychiatry to try to understand similarities and differences. It's useful to understand similarities because, as we kind of construct different models of disorders that are common across many cultures, it's good to kind of have an idea of what underlies those disorders. But it's also important to understand the differences so that we can ask better clinical questions and also better scientific questions about, what is happening to, to this person and what kind of possibilities are there. So, for example, right now we only have, a few diagnostic manuals kind of in place, and they have very overlapping definitions of how to, diagnose somebody. But we know that the range of disorders that exist are a lot, wider than that, and there is a lot more diversity. And having kind of a better understanding of the symptoms can really help with that, and that's something that a lot of transcultural psychiatrists are working on. So this isn't just me. But by extension of that, we also need to understand kind of the medicine, right? So we want to know a little bit more about, what's happening biologically, and are these cultural differences that we do see, are they also represented biologically? Like, do we see them in the underlying patterns, and then does this affect, you know, what treatments are most appropriate or what medications are most appropriate, and do we need to diversify our current options?
Est-ce qu'il y a un risque de stigmatisation quand on étudie un peu l'individualité de l'expérience de la maladie mentale ou de la détresse psychologique en abordant la recherche du point de vue de la collectivité?
So there is definitely a risk of, you know, generalities. Both other cultures and mental disorders have often been stigmatized historically and also now. But at the very core, people want the same basic things. You know, they want to feel safe, they want to have their needs met, they want to get along, usually. And different cultures might have different ways of achieving these goals, but it's not really the clinician's place to judge this. So this is actually what I'm trying to think about in terms of when I propose to have a more statistical definition of culture for the sciences, to try to instead of talking about similarities and differences, you know, which runs the risk of better or worse, talking more about probabilities. So the probability that a group of people might, you know, have a certain symptom, or, you know, something that you might want to ask about clinically. So, for example, you know, people, Tanya Lerman, an anthropologist, had a wonderful study about people with schizophrenia who heard voices in the U.S. Compared with people in India. And they found that in the U.S., people were much more likely to hear negative voices, some voices making negative comments, critical voices, sometimes even threatening voices. Whereas in India, it was much more likely that people would hear positive or playful noises or voices, or even voices that were like encouraging. And so you can see how even just knowing that this is a difference that exists, and that somebody from India might be more likely to be hearing positive voices. Now you know that you should probably ask about this, right? Because it's not going to be true for everyone. You know, there's going to be lots of people in the U.S. who do have positive hallucinations, and people in India who have negative hallucinations. But now you know that it's something you need to talk about. So in terms, and then kind of the same principle extends to the neurosciences. We know that these differences exist, and we want to ask the question, you know, do they also exist biologically? And asking that question tells us kind of, you know, what sorts of things we need to ask about in terms of, you know, developing medicines and treatments. By understanding, you know, similarities in terms of the neurobiological processes, we were able to kind of assess what sorts of things probably aren't questions that we need to be asking scientifically, that are things that seem to be more global or more common. And by understanding differences, we know that these are certain things that we need to maybe focus on more, and should try to tailor treatments and medicines to address more in a more targeted way. And so through this kind of understanding of what things can vary and what things are more likely to be similar, we can start to get actually not just like a transcultural approach to medicine, but one that might be more about personalized medicine. So understanding the variables for an individual.
Madame Crafa, quand on parle de psychiatrie actuellement, prenons-nous en considération au niveau des soins le fait que la culture est très liée au mode d'expression de la détresse psychologique, aux formes d'expression de la détresse psychologique, laquelle elle-même peut être liée à des traits culturels. On peut par exemple penser au syndrome lié à la culture.
Well, culture-bound syndromes are definitely the most obvious ways that culture affects your mental health, and the expressions of, you know, distress, the different ways that those can look. They're not always about specifically like the media or something like that, but they do tend to reflect kind of those aspects of culture, right? So, you know, for example, brain fag is a disorder found mostly in certain African countries, and it's a syndrome where people often feel, you know, sleepy. They feel like they can't concentrate. Sometimes they have like, you know, neck pain, and they do think that this could be like an offshoot of pressures by their society to become very successful. But also, we see culture-bound syndromes in our own culture too, right? So anorexia is an example of a culture-bound syndrome. It's been mostly found in the quote-unquote Western world. And, that's changing a little bit to some degree, but it does seem to have to do more with, kind of the perceptions of women's bodies and how that's represented. Sure. It all depends on kind of where you're coming from. So you can imagine traveling from a tribal community. You might never have been exposed to the idea of talk therapy before. And, how weird can that be, right? Some stranger wants you to share your most personal, thoughts. Maybe this is something you've never tried to express before. And I think, there are even some Canadians who aren't sure they're completely comfortable with it. So, coming from another culture into this idea is kind of strange for some people. It can be even worse, right? They can give you medication. And, you have to ask yourself, like, what is that? Should I take it? But the situation is usually more subtle than this. So you can imagine yourself as a Canadian, traveling to another country. You might feel upset after the move. Maybe the culture is more exotic than you're expecting, or you're having trouble communicating with other people, and this has made you anxious. So you're already familiar with the concept of talk therapy, and you go to talk with a professional, but they respond in an unexpected way that makes you feel misunderstood. They give you a prescription, but they didn't really get you. So, do you trust them? Do you take the medication they gave you? Does the interaction make you feel a little bit worse, maybe? So these are kind of the possibilities that people sometimes face when they're dealing with the new medical system. Mm-hmm. And the format of the medical system can be different, so talk therapy versus the format that they had, in their home culture. But it can also be just like the administrative details and the organizational details and the different principles leading up to it. And all of that's very stressful. It can be very confusing to have to try to figure out all of these steps and then still pursue, health resources, basically.
Parlons des réfugiés puisque c'est d'actualité. Existe-t-il actuellement au Canada des outils d'entrevue qui aident à mieux aller chercher l'information pour mieux savoir ce qui se passe au niveau de la détresse psychologique et mieux apporter l'aide appropriée?
Yes, they do have kind of a guided interview developed so that clinicians can kind of more easily know what sorts of questions to ask and kind of work more closely with a person from another culture to understand their current situation. There's also a cultural consultation service now that they're offering through McGill University to try to facilitate kind of the interactions with people who are coming in, so that their backgrounds are understood.
Malgré le stress énorme qu'il peut y avoir avec l'immigration et puis aussi l'exil dans des conditions très difficiles comme pour les réfugiés, un environnement favorable peut aider à une intégration en douce et à minimiser peut-être l'impact de tout ce stress au niveau du changement. Qu'est-ce qu'on veut dire par un environnement favorable?
Stress can be a major trigger for, exacerbating psychiatric disorders when something's already there. This is something that we know. And when somebody comes into a positive environment, it can really help to kind of reduce or prevent, anything upsetting happening, right? So a positive environment can be something like, just one that's friendly and encouraging where the person has enough resources and feels like they can communicate. And these are already very complex processes, right? So, sometimes when you come into a culture, you don't always know right away what friendliness looks like. It can be expressed in many different ways, and not all of them will seem, like the way you would show friendliness at first. Finding resources is always a big challenge because there's always a different system for it, and you have to learn what to look for and often the language skills in order to find it. And then, communicating with someone else, is quite complicated, and that can be another major blockade. And so coming into a positive environment where, people are trying a little bit harder to just make this an easier experience for you can really make a big difference for your experience in the culture, and especially during the first, stages when you're moving. On the flip side, if you are coming into a negative environment, like one where you're faced with a lot of discrimination or, negativity or bad events. It can have the opposite effect where it can really kind of make things harder for you to adapt. And this, of course, depends a lot on the person and, their past experiences and their current experiences. But it's something that, certainly, everyone can do to make things a little bit easier.
Merci beaucoup, Madame Crafa, pour votre présence à l'émission Santé Mentalité. Merci pour votre intervention et toutes ces réponses.
Merci beaucoup, Alice.